Okay, sorry for the technical difficulties. We're recording it on Zoom, and hopefully we can get it out to you guys as soon as possible. I'm Michael Van Portfley. I'm a physical therapist here at Mend Physical Therapy.
My name's Eli Edwards. I'm also a physical therapist here at Mend.
So we wanted to just hop on. We talked to Ian, and we felt like what was the biggest need for you guys right now as you're entering into your marathon training is as you're ramping up your mileage and intensity, what are some ways you can stay healthy as you continue to go into your marathon races healthy and feeling really good? And we've been receiving a lot of information and questions from a lot of our patients about the efficacy of foam rolling or instrument-assisted soft tissue mobilization. So that's anything from foam rolling to lacrosse ball to cupping, any of those modalities. And so we wanted to take a quick moment just to go over a few exercises or a few movements that has been studied thoroughly and give you some evidence and maybe a protocol to make sure you stay healthy as you continue on. So I'm going to share my screen real quick. Okay, see if we can present here. There we go, perfect. So again, we're from Mend Physical Therapy. We're located here in Boulder. And this is not going to work. There we go. Okay, perfect. So we're Orthopedic Clinic here in Boulder. Our model is a little bit different than what you'd maybe expect from a normal physical therapy clinic. We treat our patients one-on-one for a full hour. And what we truly pride ourselves on, if we have kind of a 30-second speech, elevator pitch, is that we typically and we focus on getting people better faster. So we try to get them back to their normal activity and less visits, and we feel like that's better for them personally, and then better for the overall healthcare system, that we are able to spend a little bit more time with our patients and get them back to normal activity as soon as possible. Okay, so what we wanted to talk about. So running related injuries. So that's a kind of an epidemic, specifically here in Boulder, but all runners. There's studies that show specifically that runners can injure themselves 20 to 90%. That's a huge range of people and of injuries that can occur. But we know that typically injuries are common among runners, and frankly, a lot of runners, they run through those injuries. And so our job is to be able to see if we can educate those runners to keep them healthy and keep them happy as they're getting into, more specifically, the marathons. Typically, overwhelmingly, those injuries are overuse injuries. So knee pain, patellar tendinopathy, patellofemoral pain syndrome, Achilles tendinopathy, plantar heel pain, shin splints, IT band syndrome. Those training errors are often because of the poor mechanics with running, poor load tolerance with running. And so again, re-education on how do we best decrease the limitation of that pain through either strengthening or some self soft tissue techniques. Usually these injuries occur when that load, so the stimulus you put on that load, outweighs the tissue capacity. So we all have this innate tissue capacity within our legs. When that load or the volume or intensity goes outside the tissue capacity, that's when there's pain and injury. And the greatest risk factor for injury is a previous injury. And we know that 50 to 75% of runners out there have had a previous injury before. So most likely that could be you. And so how can we best, if you've had a past injury, how can we best enable that past injury not to hamper your performance for the future? Okay, so objectives. We're going to entitle this Instrument-Assisted Soft Tissue Mobilization, IASTM. Investigate the different tools and techniques of IASTM, access the high quality literature to determine efficacy of soft tissue techniques. Eli's going to go over some practical uses and protocols for soft tissue mobilization and some other possible treatment techniques. Mm-hmm. Okay, so defining IASTM. So through the research, we find that it's a technique that involves using instruments. So we're going to use foam rolling or lacrosse ball or hyper ice or Theragun to address musculoskeletal pathology related impairments to help heal soft tissues. And so there's a lot of mechanisms that we believe is helpful for this through this treatment modality. Here are the 4 that we typically see in the literature: mechanical, neurological, physiological, and psychophysiological. We're going to go over each really quickly. Mechanical is what you traditionally think. So using that foam roll, using that roll recovery tool to help break up scar tissue and adhesions within the tissue of the skin. Neurological, we're going to talk about as well. That's the desensitization of that tissue after you utilize the soft tissue technique. Physiological, we're going to find that there's going to be increased blood flow to that tissue when you are utilizing it. And then psychophysiological, that's kind of that's the belief that it is helpful, therefore that it is helpful. So we're going to go over each one really, really quickly here. So tools and utility, I'm sure you guys have seen a lot of these: foam roll, lacrosse ball, cupping, roll recovery, Theragun, hyper ice, that's been a big one lately. Shockwave therapy, that's usually done by a practitioner in either a massage therapist or a chiropractor, or in some medical doctors' offices now. Handhold tools, the Wave tool, which is a local company, and then also dry needling acupuncture, which would be provided by a provider. The utility, and this is consistent in the literature, is for pain, tissue preparation, and increasing flexibility or decreasing tightness. So pain, even though it's not necessarily specific to running, a lot of people have headaches, especially working professionals, which is mostly comprised of the BTC. Headaches, there's a lot of good information with soft tissue techniques with the headaches, more specifically when the headache is reproduced with the soft tissue technique. So oftentimes we have these headaches. Sometimes you can pinch on your upper trap or these muscles on the low part of your skull, and that reproduces the headaches. That's when we typically find that the soft tissue technique is really helpful for that. More specifically to running, decreased perception of muscle pain. So that is more of that neurological mechanism, to where the more you're utilizing that tissue, soft tissue technique, the more that tissue is desensitized. So the brain desensitizes that tissue and is less aware of the tightness that occurs. There's a greater stretch tolerance to that tissue, even though the tissue doesn't actually change underneath the tool. There's a decreased sensitization of that tissue. And then more specifically, DOMS, which is delayed onset muscle soreness. And that's the soreness that you feel like after a long downhill run, to where you're not necessarily sore the next day, but you're sore the day after the next day. So that 48-hour soreness, there's a lot of specific information on it, decreasing the effect of the DOMS after the run, after the workout, with utilizing the soft tissue techniques. Okay. Now, tissue preparation, this is more of the physiological mechanism, to where now we find that there's actually increased blood flow to that area. So they used Doppler ultrasounds to take a look at how much blood flow is getting to the tissue of what you're using that soft tissue technique for. And they find that there's an immediate effect of increased blood flow to that tissue at the point of you utilizing that soft tissue technique, and up to 30 minutes after. So this is good evidence to support maybe foam rolling before your activity. Another study showed that there could be some improvements in sprint performance, just because that tissue is more warmed up. There's more blood flow to that area. So it could be a good adjunct to your active warm up, of which Eli is going to talk about towards the end of the presentation. And then lastly, flexibility and tightness. They found that there's been 62%. So they took a a bunch of people and foam rolled and soft tissue technique, all of them, 62% found that there is an increase in actual tissue flexibility. We don't know if that's actually mechanical that creates that tissue flexibility, or is just the fact that there's a decreased stress tolerance or increased stress tolerance. So more of the neurological, but there is increase in flexibility, which is great, especially before you go run and after as well. In terms of IT band syndrome, so most commonly, especially with foam rolling, we typically see people foam roll their IT bands, and that's a big question that we have, like, can we actually stretch out our IT band? Well, they did an actual study on runners specifically. So a bunch of people who came in for IT band friction syndrome, which is a diagnosis of pain with the IT band as it rubs across the outside of the knee. They looked at the impaired side versus the healthy side of those runners, and they found no difference between the length of the IT band, suggesting that we're not actually, if we're helping with the IT band by stretching it or by foam rolling it, we don't necessarily know what's contributing to it. It doesn't seem like we're actually stretching the tissue. And that's more confirmed by this next study showing that they took a cadaver IT band and stretched it with 9,000 newtons. And with that 9,000 newtons, that persistent stretch, the IT band changed 1%. And just to put that in perspective, a lion's jaw can produce about half that. So that's a lot of force. I don't think we're putting that much force. I mean, we can hurt ourselves a lot with the foam roll and that on the IT band, but it's not enough to make a significant change in the length of the IT band. Okay, so Eli's going to go over some considerations, some protocols. This is kind of getting to the nitty gritty of the things that we would like for you to be doing just to stay healthy with the preparation of the marathon training.
Yeah, thanks, VP. So here we're going to talk about kind of like, how do you put all that information that VP just discussed to use? So what's the utility? So the first thing to consider here is how long, so seconds to minutes, that you're actually putting pressure through one tissue or multiple tissues. And then, like, is it possible to do multiple rounds? Like, is it useful to do multiple rounds on the same tissue? Is it useful to just sit on the foam roller for the whole time that you're watching your favorite Olympic event tonight? Or kind of like, what's the best strategy there? It's also important to talk about the intensity. So how much pain do you need to elicit in the tissue? I think it's a really common question that we get a lot is like, oh, I'm near tears while I'm rolling out my IT band, or I'm near tears while I'm doing this muscle, it hurts. And so we're going to talk in just a second about, like, is that even necessary? What's useful according to the literature? Techniques could be holding in one position, like this gentleman's doing in this photo here, versus kind of like constant movement through the whole tissue. If you doing your hamstring, for example, do you sit on one spot, or do you kind of go up and down? What pace do you do that sort of thing? All of these things together is going to kind of make up the dose for whatever your intention is. So it's going to be number of like rounds per tissue. So maybe you go past the same tissue multiple times, or go from the tissue to the next one back to the same one. The intensity. So what does it feel like? If there's pain, what level is that pain? And then multiple tissues per session. So like, it might be different if you have a goal that's focused on injury versus a goal that's just kind of like grossly getting everything warmed up. And that brings us to kind of like the protocols we're going to talk about here. It changes based on the intention of what you're doing. So your goal being warm up, recovery, or pain reduction. So for warm up here, the literature tells us that in order to get true tissue change, those mechanical changes that VP was just discussing, you need at least 90 seconds per muscle. So there is no change if it's 3 bouts of 30 seconds, 9 bouts of 10 seconds, or just 90 seconds per one muscle, but it's important to get up to 90 seconds to get that full change in tissue mechanical properties. And then the literature also suggests that for a warm-up, you get that change. The change dissipates around 30 minutes if their tissue is not continually being affected, right? So if you go into your activity, the tissue would continually be affected. So you'd be good to go there, but it'd be important to do that within 30 minutes of your activity. The intensity here says that there's no need to draw pain. They did a study that had people rate their pain from 0 to 10, and they split them into different groups for intensity of rolling. So one group that was like, okay, I'm going to roll to 0 to 3 pressure, the other group 3 to 6, and the final group over 6. And there was no difference in tissue change after any of those pain thresholds. So the thing that is important, especially for a warm up here, is we want you to stay below your pain threshold, and that'll kind of keep your nervous system kind of at more of a steady state and not kind of flared up and maybe at risk of kind of other, like paying attention to other aches and pains and that sort of thing. For technique here, if it's a warm up, truly, it makes sense to kind of warm up all of the tissues equally. So maybe moving smoothly, whatever pace you'd like, but smoothly through the entire muscle, and then all of those muscles of the lower extremity. So your dosing here might be through the calves, hamstrings, glutes, going up the back there, then inside, outside of your quads, and then through the front, from your quads to kind of like that tibialis anterior on your shin muscles there. That would be like a nice, well-rounded tissue prep for warm up, as well as kind of like the IASTM approach. It would be really useful to do something more active to get the muscles nice and primed for your run. So that might be like a low resistance exercise at like 15 to 25 reps, or kind of like if you're sidestepping to get the glutes activated, maybe you're doing 20 steps sideways each direction. And the goal of that would be to get some of that minimal to like maybe a little bit of moderate muscle burn, but that muscle burn that's going to return back to baseline in like 60 to 120 seconds. So 1 to 2 minutes there. As well as like a combination of both of these ideas would be some dynamic stretching. So here you're elongating the tissue for like a short period of time. It's going to increase blood flow. It's also going to tell your nervous system, all right, pay attention to this muscle. We might have to use it pretty soon. So some examples of those could be like that walking hamstring stretch or walking lunge, but I'm sure your group has many more options for that. So the second goal, being recovery here, could be thinking about time. You'd want to also get to that 90-second threshold, but again, kind of whatever mix of time you'd like per muscle there. Intensity for this one, again, you want to do below your threshold of pain. And then it's really important, because we're talking about recovery, not accidentally eliciting pain. So if a muscle is maybe sore from your workout, and as you're rolling on it, the pain is increasing, that might be a good sign to yourself to say, okay, this pain signal is going to my brain for a reason. I should listen to it and maybe move off this muscle or do something different. Again, because it's recovery, we just kind of grossly change the blood flow to the muscles as you're cooling down. So that would be moving through all of the muscles that were used. And then again, here's like the same list of some probably pretty common and important muscles for those runners. Similar place in recovery, another passive exercise here would be some static stretching. So this is the time that you maybe want to see if you can change kind of that deformation of the muscle if something's feeling really tight. For static stretching, the literature tells us that you need 4 to 6 minutes total to cause true tissue deformation per 24 hours. So again, that doesn't, just like the 90 seconds, that doesn't have to be 4 minutes at a time. That could be 4 rounds of 1 minute over that 24-hour span, but that would be kind of up to you based on what your goals were for that tissue. And again, it's always important to do stretching below your pain threshold. There's no reason to stretch kind of into pain you don't get more bang for your buck. As long as you're feeling kind of like a little bit of pull through that muscle, that's perfect. And then our final goal here to consider is going to be pain reduction. So here again, 90 seconds is what the literature tells us is important for any type of tissue manipulation with a device. The intensity here, it's even more important to be below your pain threshold, especially depending on your injury. So there are some caveats to this, but it's usually, especially for runners, you don't want to keep playing into that inflammatory response, flare your nervous system up, kind of create more long-lasting pain inadvertently. And so we would suggest here kind of staying below your pain threshold. The technique here might be more specific to whatever muscle or body parts are causing pain. So it could be movement over the entire muscle if that feels like it's reducing your pain, or you could find maybe isolated trigger points where in your hamstring, maybe it feels a lot tighter towards the top where it's kind of attaching to your hip. Then you could spend more time there, but then still rolling through the whole thing to get those same mechanical benefits of increasing blood flow. And then for dose here, again, just to go to that muscle that's maybe causing some discomfort, and as well as the opposite muscle. So again, if you're having some hamstring issues, it could be useful to roll through the hamstring as well as the quadriceps with the opposite function to create maybe a little bit more length and make the quadriceps create a little bit less active, meaning less pull on the hamstrings, just kind of as you're going through the rest of your day, not in sport. Another common kind of more active technique to cause muscle elongation and increase blood flow, as well as increase some strength here, would be eccentric muscle strengthening. And so an example here is like after a hamstring strain, maybe you're doing some single leg deadlifts where you're loading that muscle as it's stretching. And so for this, we'd recommend typically like around 8 to 10 repetitions at a higher resistance, really until you get to that muscle fatigue or even to a place where it's difficult to complete the exercise. And that's what the literature tells us is really useful for muscle strains once you get to that place that you can do these exercises pain-free. So this kind of takes us to this slide here, where it's like when is foam rolling or some of these other exercise ideas maybe don't take us all the way to where we want to be. So the first thing I'll note is that the body is very, very good at healing itself. And it's important to listen to any pain that the body is generating because it probably means that something needs to be changed. So for these ISTM or other techniques, they should definitely make you feel better and relieve your pain and kind of improve your ability to participate in exercise. But they all are also just kind of like one approach. They're a passive approach, which typically passive approaches are useful to make us feel better or feel ready to exercise. So it could be great for that kind of warm up or kind of the other protocols that we talked about there. However, if we're trying to create real change, you need to do something actively to maybe rebalance some muscles or change the way that the joint or kind of a certain motor pattern is being performed to actually change something so you're not having pain for a long term. And so we recommend that if you're kind of going through these techniques and either your pain or function seems to be worsening with each activity, as in you're trying everything that you can think of, but running day to day or week to week seems to continually being on this decline slope of function, or if it seems like you've really plateaued, like you're having pain each run, you try everything you can think of, you get to mile 5 every run for a whole month and you're getting that same pain. Those are times that we would definitely recommend that you come in and chat with us here at Mend. And because you all are part of this BTC group, we'd love to do a free consultation to see if there's any ideas that we have for you that you're not already considering for yourself. In terms of foam roller specifics, on our YouTube page at Mend Colorado, there's many videos for different types of techniques to roll out different muscles. And on that same note, I'd like to extend an invite to email us. If something's on there or you're interested in a certain technique and you're not really sure how to perform it, or if it would be good for you based on what your goals are, then definitely feel free to reach out to us. Here's our emails here. So VP at Mend Colorado and then Eli at Mend Colorado. And that's all we have for you. So thank you for your time.